Needle exchange really helps reduce law enforcement's risk of being stuck by a dirty needle because there are fewer dirty needles laying around.
A police officer is less likely to be stuck with a contaminated needle if in fact these things are being used once and then disposed of properly.
Their whole purpose is to reduce the risk of HIV, and that's a noble cause in my opinion. But at the same time, you kind of enable the activity. What's the difference if you stop them from getting HIV with a clean needle on this particular day, then that same day they take that clean needle, inject themselves with heroin, and overdose in a porta potty? What have you done?
We live in a society, we have a lot of contact with each other. Family members, health workers, police officers, we're all constantly coming into contact with each other. As we reduce the risk of infection to a drug user, for example, there are benefits that accrue to the rest of us.
Homeless healthcare now has become an integrated drug treatment program that services the homeless population of Los Angeles. We'll usually have somebody here that will stand here and count the used syringes. And then there's a sharps container down here. Catches them.
Our needle exchange sites are very comprehensive. We not only provide clean needles, they also provide HIV and/or hepatitis C testing.
Anything else we can do for you today?
Do you guys ever refer people to drug programs?
We first have to get them into a detox, then we can put them into treatment.
And do you guys also have medical kind of facilities here?
This is the medical room here. The whole thing is centered around healthcare. In the HIV prevention, the wound care services. There's so many people that come through here that cannot access traditional healthcare.
There are different kinds of needle exchange sites. Some of them are in drug treatment centers, others are based out of clinics, some are outdoors like ours. In a lot of instances, we're the only point of contact for people who use our services with other services like housing services or drug treatment, detox programs, legal help, medical help.
The first time I heard about it was on the radio, and as a policeman and a law enforcement kind of guy, my first reaction was, oh heck no, this is a bad idea. You're just encouraging people to use drugs, you're making it easier for drug addicts to maintain their addiction. Over the years, and as I talked to the folks from the Needle Exchange, and as I talked to our officers, I think I've come to realize that the Needle Exchange programs are actually helpful in preventing AIDS, preventing HIV, preventing hepatitis, and hopefully preventing officers from getting needle sticks themselves.
If you want to stop someone from transmitting HIV or Hep C through a needle, you give them a clean needle.
The LAPD policy regarding needle exchanges is that we don't stake out on needle exchanges with the idea of arresting drug users. We don't arrest people or impound needles.
If we get a call at a needle exchange, our department policy is that we call a supervisor.
But we also don't consider that a needle exchange and the area around it is a drug enforcement free zone.
I enjoyed talking to him. I'm glad to meet him face to face. I always like to hear from the horse's mouth. I have the utmost respect for him and what he's trying to do. The needle exchange is there to provide a service. And if someone has a clean needle there, or if they're there to exchange a dirty needle, you just use common sense and let them do that.
242 Rampart to handle identified. 3435 Wilshire Boulevard 3435.
Crime in downtown Los Angeles is at a lowest point that has been in our lifetimes. I can't attribute it all to the needle exchange program, certainly, but I think it's a piece of the puzzle. I think the needle exchange program is an important component of our crime fighting and our quality of life improving programs.
And we haven't seen increased crime or drug use just because the needle exchange comes up. However, a police department can anticipate that where a needle exchange comes in, there may be an opposition to the location of the needle exchange there.
This exchange location was developed in collaboration with the local law enforcement. They in fact suggested this was a good location based on their experience in the neighborhood.
It's a controversial subject. Community members are going to come down on different sides. My recommendation to police departments would be get a supervisor involved, handle it intelligently, not in a knee-jerk way.
public health is a public safety matter. When a needle exchange comes into a neighborhood, it provides a safe place for people to dispose of needles. If you don't have a needle exchange, then you're more likely to see needles in your park, on your sidewalks, and on your streets.
We're here to just provide health services to help the community, and that's our sole mission, and not to interfere with law enforcement or try and control how they do their job. We would like to work with them, not against them.
It's good to know that that's here for the people. It's good to know. Now I know they're doing more than just handing needles out here. Give me your needle, here's a clean one. That makes me feel a little better.
Okay.
There you go.
Thank you, sir. Can I get a hug for the homeless? You got that? No. Bye.
He's not there to judge, you know? He's just here to help. He is saving lives in his own way, and I'm saving him in mine. And I can live with that.